Ladies and gentlemen, welcome to the Africa Health Agenda International Conference 2023 in the beautiful city of Kigali. This is a global health conference started on Africa, by Africa, in Africa, for Africa in 2014. So it's been running since 2014, and this is the 5th edition. I am full of hope that the center will hold. My hope rests in the heart, ingenuity, and resilience of the African people. It rests in the principle of Ubuntu. I am because you are.
In the next 3 days, we will be covering many aspects of numerous health challenges that we face on the continent and beyond, including the biggest global health threat in the 21st century, and that is climate change. Africa CDC, we are honored to co-host this very important event this year with AMREF and the government of Rwanda, and we look forward to many more convenings, larger, better, and indeed more effective in creating the change that we need on this continent.
Speed matters in health, in outbreaks, stopping an outbreak. The factor time is the most important one. This is one of the biggest lessons we learned, that solutions for our problems doesn't need to come from far. We have it in our hands.
I'm hopeful that we're going to be investing in health systems that are resilient. So I think that investment in health, both for pandemics and for access to services, is one of my biggest hopes, but also it's a concern because of the impact of the pandemic on our economies in Africa. But I'm hopeful again that global solidarity, recognizing that we're all in it together, and next time we'll do better than we did for the COVID-19 pandemic, will ensure that the international community continues to invest.
If you look at our health systems, we need to be having a business orientation about running our health system, not to make it for profit. Our profit is the good health of the people, but we need to reduce all the inefficiencies and hold the wastage, or tie the loose hands, really business orientation into running our health system.
As a country, we are working to enhance this capacity in manufacturing to make sure that, because this is a critical pillar in the health security we are envisioning. So, but this also requires strategic action as a continent with the leadership of regional institutions like the Africa CDC, where we need our donors and partners to invest on as we envision sustainability as we move forward.
All this expertise is resource as well. How are we bringing that resource to play when we talk about reinvigorating the health sector? How are we keeping our experts on the continent? What are we doing to remunerate them better so that they actually stay? If we do not look at resources beyond money, then it means we'll continually be looking outside of the continent instead of internally.
I think that within this UHC agenda, there are two stakeholders we need to make a concerted effort. Again, the citizens and patients, but two, also the health workers and those within the system. They have extremely rich knowledge that I believe is not sort of leading us to problem solve, to innovate, and to deliver the services.
I think scientists must learn that in this one health concept, there's the society, and the pathogens don't work alone without the human being. Therefore, we must understand all those other areas. As to the point you raised, I think it is important for us in Africa to understand that as our education must take into consideration these other issues.